As much as possible, all of them. Different professors in our center and different orientations have us working with different groups. So, for example, over the years, I have been more focused on working with public officials, yes, especially with regard to coastal land loss, subsidence, and the issues of the coast. The other emphasis of my background is neighborhood associations, because my earliest work was here in New Orleans on gentrification of neighborhoods and the dynamics that changed when the neighborhood started getting renovated, for example.
That's an interesting topic, and I wish we would have time to talk about it maybe another time.
Sure,
but
sure,
that is an important topic, yes.
But the other of my colleagues, one of them is very interested in the role of the faith-based communities, and as you know, the volunteerism that came from those groups, as well as the secular groups, since Katrina has just been phenomenal. And we had worked with the American Red Cross and the city and the faith community before Katrina on the Operation Brother's Keeper, which was a simple concept but challenging to implement, of encouraging members of a group, a congregation, to invite those other members who did not have automobiles to ride with them, yes, on the evacuation. Another thrust that we have is working with nonprofit groups that are advocates, or we call them stakeholders. For example, with the elderly, the need for an evacuation process that really takes care of and cares for the elderly has been one of the most serious challenges that the city has faced. And our efforts have been toward gathering together and meeting with the stakeholders, the organizations such as the Council on Aging and others, and asking two questions, or sharing two things. Finding out what the best practices have been from the organizations, and that is the step of giving respect and honor and use of the local best practices, but then bringing to the table a discussion of what the national best practices are. And therefore, by combining the two, you grow in capacity to understand what should be implemented.
So what you're saying is that, for instance, pre-Katrina, mm-hmm, that part of the population was not well organized. Mm-hmm. But since you have been studying that, mm-hmm, should another catastrophe come our way, have some of those things been worked out?
Yes, they have. It's I have to begin by saying that there's much that needs to be done, but the improvement is quite amazing. We just recently met this week again with some of the groups, the nonprofits, and with the city, because of course it's always important that the city be part of the conversation, because they are the lead, on the efforts. And the assessment is that a lot of the pieces of the evacuation worked very well, and the nonprofits were very much a part of the successes of that process. For Katrina, we had over 70% of the people who died as a result of the storm were over 60 years of age. And there's only about 17% of the population who is over 60. So it was such a disproportionate death toll on the part of the elderly that it was very evident that there was not an adequate system for evacuating the elderly before the storm.
And what level of confidence do you have that should another situation occur that we won't have that kind of an outcome?
The way in which you know the answer to that is the degree to which the public believes that the experience will be appropriate. And the elderly have had the opportunity in Gustav to have a lot of their concerns assuaged by the way in which the community has responded. But there are still some challenges that we now know that have to be resolved, or in the future the elderly will be less inclined to take another chance to be evacuated. And it has to do with, for example, on the return, the process of re-entry and making sure that when they go back to their homes are safe for them to go back to. They have electricity, simply that they have food. Because the grocery stores may not yet be open, the food in their refrigerator has been emptied or is spoiled, And if they were just simply to be dropped off at their home without some concern and knowledge of that, they could then just be in their home without food. So it's as simple and as sad as that kind of challenge.
Well, you mentioned that you work with the public agencies and
yes.
officials. What level of support are you getting from the city, the parish, the state officials?
It's much improved, much improved. Before Katrina, we really, as has been acknowledged and reported in the paper, we hardly had an emergency response system, and now we do.
Now, I'm going to ask you something that may be controversial, but I understand that before Katrina, you recognized a potential disaster, and you, I think, gave some warnings before Katrina that this could happen to us. And so I'm interested in your view of what could or should have been done before we ever got hit, and then to the level to which changes have made after the disaster. Tell us about that.
Well, it was an interesting experience and came to me sort of accidentally. I was invited to write an editorial piece for a publication called the Natural Hazards Observer. The University of Colorado has the center there that's sort of the focal point of those of us who are disaster researchers and applied specialists. And what I did is I compiled what was known by the scientists, physical, biological, social, anthropologists, sociologists, the whole gamut, and included my own research on evacuation. But the article spans the subject matter and basically put together the scenarios that the scientists had been predicting would happen.
Yes.
And I wrote it as if Ivan had hit New Orleans instead of veering off. And so much of what was written in that article did come to pass.
You described what situation would look like if we had a major hurricane or a flood as we had. And you're saying that what happened very much verified your expectation of what was going to happen.
The group of scientists' expectation. That's the point. I compiled.
Okay. You were a participant in that.
Yes, that's right.
But since were the others from New Orleans, or you were?
Some, LSU, Tulane, of course, the University of New Orleans is very active in coastal science, and then other scientists from around the country who've been partnering with us, yes.
All right. Well, now, when you mention coastal science, I understand you are a member of the board of the Coalition to Restore Coastal Louisiana. Tell us about that.
Well, that is an organization of both individual members but also of organizations. And it has been functioning for about at least 15 years. Mark Davis was the long-term director. Mark is now retired from that position and is a director of a center at Tulane on water studies. And the purpose of the organization is to call attention to coastal issues and to address ways in which those coastal issues can be resolved. And prior to Katrina, the focus was more heavily on environmental issues. I won't say separate from human, but really strongly environmental. And what's been interesting about that group since Katrina, has moved to having more of a balance between the subject matter. And so it's growing in its concern for coastal communities and the risks that they are subject to. Now, I don't mean they didn't consider that before, but now they really are recognizing that it's important to really be asking questions about how we can preserve these coastal communities. I call them the coastal cultures, and how we can work together with regard to coastal restoration and storm protection.